Chairman, or Mr. Ranking Member, thank you. Thank you for your service on this committee. Dr. Butler, I have questions for you, but I thank all of you for being here, and I took seriously the testimony that you presented. Dr. Butler, in November of last year, the National Academy of Sciences published the Gulf War and Health, Volume 11, Generational Health Effects of Serving in the Gulf War. This report concluded that there is a substantial, quote, there's a substantial dearth of information, unquote, on the generational effects of toxic exposure. Also within that report, the National Academy prioritized the collection, storage, and maintenance of a comprehensive baseline and longitudinal data and biospecimens from veterans, their partners, and their descendants in order to develop an effective, successful health monitoring and research program. The Department of Defense and the Department of Veterans Affairs continue to develop that an individual longitudinal exposure record. And my questions to you, first of all, I learned in our efforts to have research completed that would demonstrate whether or not there is a medical scientific connection between generations, that before that was possible, we had to demonstrate that there wasn't sufficient evidence in that regard existing. And so your study, Dr. Butler, at the National Academy of Sciences was very important as a step in determining that connection. And so my question is, I just want you to expand upon that report, your findings, and if you have any sense of whether the cooperation between the Department of Defense and Veterans Affairs is on its path toward getting the necessary data about the necessary facts about the occurrences.
Thank you for the question. The Gulf War and Health Update 11 report not only looked at the existing evidence regarding possible reproductive effects and exposures, but also put together a comprehensive research plan that could be followed that would allow VA to make more informed decisions about this in the future. The report is still a relatively new one. As Dr. Hastings mentioned and Dr. Rausch, the ILAR system that is about to come online is going to provide an important new source of information on exposures and getting a handle on exposure assessment, which is typically the poorest part of the information set that's available for making decisions like this, is going to be really important in the future in getting a better handle on outcomes that might be related not only to reproductive and generational effects, but all the other effects.
Do you have a sense, I heard and read the testimony of the department, do you have a sense that that process is, which is soon to be completed and available, utilized, is it the right process? You're comfortable with the direction they're going, or have you not analyzed that?
The National Academies has not yet analyzed it. The comprehensive research plan that was put forward as part of the Gulf War and Health report does provide a roadmap in the future for getting information specific to reproductive and generational effects.
Do you have the sense your roadmap is being followed?
We don't have specific information on what's being done at the moment.
Okay. Thank you, Doctor. Thank you, Mr.
Senator.